Good morning, ladies and gentlemen. Today we're going to discuss the proposal on the table to create an urgent care clinic within 20 miles of our facility. Urgent care centers provide care on a walk-in basis, typically during regular business hours, as well as evenings and weekends, though usually not 24 hours a day. Urgent care clinics commonly treat conditions seen in primary care practice and retail clinics, including ear infections, strep throat, and the flu, as well as minor injuries such as lacerations and simple fractures. In contrast, to emergency departments, urgent care clinics generally are not equipped to deal with trauma, provide resuscitation, or admit patients to a hospital. Consumers are more likely to walk into an urgent care clinic for treatment of minor illnesses and injuries after hours when their regular providers are closed. As a matter of fact, 80% of patients who come to an emergency room have non-emergent medical care needs. So coming to an urgent care center is more effective than going to the emergency room or trying to get an appointment with their primary care providers later. Due to EMTALA, ERs cannot turn patients away. So emergency room patients are triaged as they sign in, and the more serious cases go first. The patients with the minor illness, such as strep throat, would have to wait quite literally for hours before being seen and end up paying an outrageous amount of money if the patient's medical plan does not cover the visit, since it wasn't an emergency. Americans seek a large amount of non-emergency care in emergency departments, where they often encounter long waits to be seen. Urgent care centers and retail clinics have emerged as alternatives to the emergency department for non-emergency care. We estimate that 13.7 to 27.1% of all emergency department visits could take place at one of these alternative sites, with potential cost savings of approximately $4.4 billion annually. The primary conditions that could be treated at these sites include minor injuries and minor acute illnesses, strains, and fractures. There is some evidence that patients can safely direct themselves to these alternative sites. As you can see by the map, there are 7 urgent care clinics within 15 miles of our location, 3 full-service hospitals, and 6 medical clinics. The market is oversaturated, ladies and gentlemen, and to open another urgent care clinic within 20 miles of our current location when there are no less than 7 that are much closer already would be a foolish waste of money. I personally cannot recommend that we do this since the market is already oversaturated. Thank you for your time. If there are any questions, I would gladly answer them now. Have a nice day. Bye.